also they can go ahead and practice that in their clinic and complete the logbook. On Friday, we're going to come back either virtually or face-to-face online and to wrap up the session. Friday will be about reflection of what you've done both on the first day, second day, as well as on first and second day, where we'll talk about your logbooks and what you've done in the logbooks, what are the challenges that you've come across, and how you overcome those challenges. And that will be end. We expect to finish on Friday around 12 o'clock. Okay? On the second day, I forgot to mention, the management of the hospital also, there will be refreshment on the second day, but I think that will happen in the physiotherapy department. So on the second day, we are converging at the physiotherapy department for the practical. My name is Timothy. I will be facilitating the sessions throughout the week. I crave your indulgence. This is a practical session. For me, I will expect everyone to practice. Okay? Everyone to practice. That's the only way I can be confident that you guys have been part of the session. So when there are planes across, whenever we are doing it, there will be a point whereby you will practice amongst yourselves. So please try as much as possible to practice throughout the day. Any sort of questions before we start? Any questions? No? The toilet, I think, there is a toilet downstairs. We have a toilet, I think maybe the toilet is downstairs, the one is working, but when the HOD comes, we will confirm that. We have the toilet when you go downstairs. There is one upstairs, but I think the water system might not be working properly. So it might be for us to utilize the one downstairs. Lastly, I have put in a survey in the WhatsApp platform. And if you've not completed it, can you please complete the survey link? But if you completed it, thank you so much. We're going to do a quick summary of what we've done in the online channel. We're talking about patient handling. But we're talking about the dynamic risk assessment whenever you're doing patient handling. Whenever you're doing patient handling. And we're going to start with an inanimate object. So we're going to start with an inanimate object. Okay? So when you're doing patient handling, what we're talking about is dynamic risk assessment. For those that have attended the online session, there is how do you go about carrying out a dynamic risk assessment when you want to carry out handling generally. For those that have undergone the online session, is there any acronym you can think of that we talked about for the dynamic risk assessment? Yes. The ELIT or TILIO. Yes, the ELIT or TILIO. So, yes. Whenever you carry out risk assessment, there is the dynamic risk assessment. There's a framework that helps you to think about it. That's the TILE, the same spelling of TILE that we are standing on, but at O at the end. TILE O. Okay? O the L. Okay? The TILE is spelled T-I-L-E, and then the O at the end. The L is spelled E-L-I-T-E. Now, this is something you can do always dynamically. And what we mean by the TAG, I think Suleiman is trying to explain to us. So the T stands for the tax, right? So the T stands for the tax. And when we are talking about the tax, we are talking about what we're going to perform. What we're going to perform. What we're going to perform. And if, for example, I'm going to apply it on, let's say we're going to try it on the inanimate object. The task is for me to carry this box from this point all the way to where our new castle is sitting on the box. So that would be the task for me. To carry this box all the way from here to here. If I'm carrying this box What other risk assessment would I be thinking about? Absolutely yes. The first and number one principles of handling is it necessary for you to complete the task? Always before you do the task, is it necessary for you to do the task? Why do we have to think of is it necessary to do the task?
So it's not necessary.
Yeah. Yes. If it is not necessary, there is no need for you to do the task. Okay? And the reason is because we all know that some MSK injury is due to repetition. Okay? So it's not the concept, oh, I will just do it this time around, just no. It's the frequency at which you do things over and over again that exposes you to injury. So always, whenever you're carrying out a handling task, a patient handling, or any handling, think that is it necessary at the beginning to even do the task? Is it necessary? If it is not necessary, there is no need to do it because the more you do it, the more you expose yourself to injury. Now, let's say it is necessary for me to move this task from this box, from this floor, all the way to where our will is sitting. What should I think about it? Sorry? Okay, the distance. I have to think of the distance. And why would I need to think of the distance? Sorry? Sorry? How long it will carry to make the distance. But under the distance, if we look at the dynamic risk assessment under the task, the distance will fall under what? So we say T is the task, right? So we have the remaining acronyms. The distance where will it fall if we are doing the risk assessment? Environment, okay? So the distance is under environment. So when you're doing the risk assessment, you have to think of the environment at which you are carrying out the task. Okay? So I have to think of the distance, and why I have to think of the distance is if it's going to be a long distance, can I carry that? Will I be exhausted on my way? Okay? So the distance, how long will I carry that? So the first T is the T in the task. The next we can think of the environment, which is the D at the end. Okay? What other things can I think of the environment when you're going to handle in general and patient is okay? Yes. So, okay. So we take one at a time. We take space and we come to the uneven environment. So we think of space that you're going to carry the environment. Why do we need to think of space? Okay. So there are two things you've mentioned. In terms of space, we are talking about sometimes when you carry out handling, if you are cramped in a space, will you be able to carry the handling effectively now? And we talk about the dynamics of risk assessment is about having a good base of support. So space is not only about, so there is a space in terms of the landscape at which you are moving in terms of the obstacles on the road, but we are talking of you have enough space. Okay, to carry out that movement. Sometimes we are cramping ourselves trying to figure out how we can pull a patient or pull a patient. Our therapy unit, whenever we see patients, we have enough space where the staff can move around. So that's one in terms of the environment, the space at which you move. But the second thing that we can think of space in terms of when you're moving obstacles on the road. Okay? You can think of the obstacles on the road. And I think Fatima was mentioning about uneven surfaces. Okay? Uneven surfaces. But apart from uneven surfaces, in the environment, what other things can we think of in the environment? Lighting. Why lighting? In particular to our patients. Why lighting? Sorry? To avoid falls. Okay? So lightning is to avoid falls. Some of us might appreciate this lightning. We can try to move easily, but our patients, some of them rely on this vision to be able to stabilize themselves. Okay? So it's the lightning. When you are moving equipment or when a patient is you trying to encourage a patient to move, you need to think of the lighting. Okay? The lighting. The other things what we can talk about is the temperature, the weather, etc. When you are walking and slippery surface, you can see water still on the floor. But another thing in the environment is whenever they are building, sometimes all we think of is just a fancy, nice big building, which is brilliant. But sometimes, if it is for a patient, have you thought that this patient sometimes a slippery environment might make them to fall? Okay? So these are some of the things, maybe not for us, but certainly for the contractors or management. Whenever you do roads or when you are seeing your physiotherapy department, how will your patients go? What is the environment like? Would they be exposed to the risk, slippery risks of fall? These are all the things we can possibly think of the environment. So we think of tax, which is moving the box from point A to point B. We think of the environment. What are the rest of the things that we should think of when we are moving this box? So the individual, the load. Okay? So these are two different things. When we talk about the individual, we are talking of yourself. Okay? You are taking of yourself. Some of us are very strong body build that we can move things, some of us are not. So we have to think of the individual, okay? Yourself, whether you can be able to move this object from point A to point B. Or maybe you have an injury. Moving an equipment or moving this station will expose you further to this injury. You have to think of that. Okay? So the individual. And the load. When we are talking of the load, we are talking about patients. When we are talking of the load, we can talk of the box, for example. So the load is about anything that you are moving. So you need to think of the load. And what are the things, if it's a phase, what are the things? Let's start from this box. If I'm moving an inanimate object or any box, okay? Or if your staff are moving any box, what you need to think of is the weight of the object you are moving. Okay? The weight of the object you are moving. It's good practice to check whether you can move the weight. Okay? There are recommended weights. And some of these weights, not that there is any gender bias, but there is gender difference in terms of what weight a female person can carry over a male person. So there are weights. So it's important to see what weight can you carry, what is the weight of the object. Some objects have weight restriction on them, some don't. Our patient, by mere looking at them, you have to think how heavy they are, whether you can be able to move on them. If it's an inanimate object, the other things you need to think of is how secure the load is. Carrying a load that is moving up and down, it exposes you to risks of injury. Okay? How secure the load is. So think of securing the load. Think of securing the load. If the load is unstable, if it's moving up and down, think of securing the load before you move. But if it's your patient and you're going to move your patient in bed, sitting to standing, or whatever you're going to do with the patient, what will you be thinking in terms of your patient that will influence your handling technique? What will you be thinking that you need to be careful or risk assess in terms of when you're moving your patient? The weight of the patient, yes, that's one. Condition, what do you mean by condition? Okay, the pathology that is being managed, yes. The status of the patient. What do you mean by status? Maybe the ability of the patient to participate. Okay?
Cognition, or maybe you are talking about brain field of the patient.
Yes.
Cognition, like for the animals of the life.
Yes.
Hello?
Yes.
Okay. Again, it is clear.
I'll see. Yes, yes. So in terms of the status, functional ability of the patient, the capability of the patient, the strength of the patient. So yes, we'll come to those points that HOD mentioned. So I want to stay on the digital media. Are we good?
Yes.
Okay. Can we reduce the number? In terms of the physical, because do we have to move it? Do we have to move the patient? That's the first principle. If we don't have to move the patient, we ask the patient to move themselves. Okay? If we don't have to move the patient, we always have to ask the patient to move themselves. The nurses just ask them to do it themselves. The physiotherapists, we are bread and butter, telling the patient to do it is we have to do it. So I know we are all interested in helping our patients. I know we are also want to, in this part of the environment where we practice this, somebody pulling you is helping you. But I think that we have to do reversal. Us pulling the patient, we are not helping them. We have to step back and allow them to do as maximum as they can. As maximum as they can. Now, what defines maximum is you as a therapist will establish a baseline. And in a standard procedure, the therapist will give a moving and handling process to the rest of the hospital staff who they will follow because we establish the baseline. So for the nurses, where there is the absence of that moving and handling process, you can just as much as possible encourage the patient to do as maximum as possible. Safely. That's what I was mentioned about the condition, the functional status of the patient. Safely. If they can do it safely, okay? As maximum as possible safely for their physical status. And then you meet them halfway where they cannot be able to do it. And we look at those equipment. What it will also follow. You have to think of their cognition. Sometimes it's about communication and instructions with these people. And they be able to, if they can have a functional status, but because their cognition, they don't have that cognition to be able to understand what we are telling them. Even with you giving the instructions, it will be difficult for them to follow the instructions. Or they will not be able to follow the instructions to be able to do the task you're asking them to do. So you need to think about the cognition. But apart from that also, you need to think, when you are handling a patient and you are moving them, especially when you are taking them to sitting at the edge of the bed, or when you are standing a patient, either for the first time, or maybe not for the first time, but they are afraid, how impulsive they are. And they just suddenly change in their attitude. Now, it pushes you at risk. It's possible you can do everything by protocol, but you do not establish the fact that this patient is impulsive, or maybe they can have anything that will make them to be active, that will make them to fall. Okay? So when you are moving them also, you need to establish other things apart from their physical status. Dr. is talking about psychological being as well as the cognition. So their ability to, their impulsivity. And it's not necessarily you establish that necessarily in your handling, but within the patient, when we are doing our assessment, sometimes we can establish whether the patient is impulsive or not, whether they can follow instructions or not, and these are things that will inform your judgment. Because a patient, for example, that is not impulsive and can follow instructions, it's possible I will be able to use a handling, for example, using the patient turner, which will look at that. But the patient that is impulsive, if I use the patient turner, the patient can suddenly let go of the frame, and then he will fall down. Okay? And then that will be a big problem. So it's something that we need to be aware of. So we've looked at the T for the class. We looked at the I is for the individual that is carrying the object. We look at the L is for the load, and we said load can be animate or inanimate object. Inanimate object is the patient. Okay? And we look at what the things we can look at in our patient, and we look at the E, which we say is the environment. Okay? Now, if you can, if it requires a lot of your strength and energy, this is why you look at the others, or E, which is the equipment. Okay? Equipment. So if pulling the patient requires a lot of your effort, and the patient cannot meet you halfway, you need to think of equipment where it's available. And you can, there are different varying degrees of equipment which will look at that. That will help you in moving your patient. There are different varying levels of equipment that will help you to move your patient, depending on the status. Okay? Depending on the status. For example, if the patient can be able to stand up and sit at the edge of the bed, but that's all they can do. Come up, sit at the edge of the bed, they cannot be able to pull themselves into standing position. Then this is where we start looking at this piece of equipment. So we look at this. This is our patient corner equipment that we use it for the patient. If the patient can't be able to stand up and come to the seat of the bed, instead of us pulling the patient into standing, instead of us supporting him, which we will do anyway if in the absence of equipment, but we can use this to support the patient to stand. And we can use this as a piece of the application to stand. But secondly, we can use this for transporting patients from sitting at the edge of the bed into the chair, and then they from sitting at the edge of the bed into the chair where they will sit down. So that's one equipment that we'll use it, and we'll have a practice demonstration about using this. Now, that's one. But secondly, we don't have to use this. If we want to get a patient out of the bed, but the patient cannot sit at the edge of the bed, then this will not help us, because this wants the patient to come to the edge of the bed. But if the patient is totally bedridden and we cannot get them out of the bed, and this is where we use their hoist. Okay? We will have a practice at the hoist. We use the hoist to help move the patient that are totally dependent or bedridden, whereby the hoist will help pick the patient right from the bed all the way to the chair, or from the chair into the bed. Apart from that, if we want to reposition the patient, we have the sling, which is the piece of equipment we considered earlier on. We have the slings, which we also look at them later on. We look at that. The sling is the slippery equipment. The principles of the sling is to eliminate friction when you are moving the patient in there. And you can use this to reposition your patient a lot. For me, I think if there is anything I would definitely carry for a dependent patient, a patient that is heavily dependent, is this. Okay? Because it helps me readjust the patient, move the patient up and down, and I can use it for different varieties. There are safety considerations we have to consider, which we'll look at that also. And there are different types of slings, which we'll look at that also. But we also have the banana board, which I think some of us have considered the banana board. So the banana board is here, I think. Can we unpack all the equipment, please? So we have the banana board, which we can use it. We will look at that also. For the banana board, like I explained earlier, is for paraplegic patients, for patients who are heavily dependent on, they have upper limb strength, but they don't have lower limb strength. The banana board is just for sliding from, the banana board is just, the banana board is just for sliding from the chair, from the bed, sitting from the edge of the bed into the chair and back. And the last one is the bed levers. The bed levers is that metal which they will try to fix it at the edge of the bed to try to move the patient back to back. Okay? These are sort of equipment that we'll be using. Okay? I will demonstrate them. But let's come back to what we're doing. In dynamic risk assessment, we have tasks, what we're going to do. We have I, individual, you, the person that is doing the task. We have L, which is the load that you are carrying and it's our patient in this situation. We have the E, which is the environment at which you are doing, and we have another E, which are the equipment. For the equipment, there are lots of safety procedures that need to be considered, and we'll look at that, because there's no point in your patient being exposed to this. So you are, as the healthcare professional, is responsible for that. Now, let's come back. Let's say I'm going to just a demonstration. Okay? If you invite them, just there's the slings that just for demonstration and just for us to understand, just to talk about the principles of efficient movement and handling. Now, you guys are going to help me. So my task is I'm going to carry this box from here to where those guys are sitting on that edge. Okay? I have checked the weight, the load of it. The object is good. I can carry the load. I've checked my environment is clear. I'm going to carry this from 820. Yes?
You said Cairo is 4.
Yes. So the O stands for others. So the others, okay? The O stands for the others, and that is, but the L is the E, the first E is the environment, the last E is the equipment, and then the L is the load, the I is the individual, the T is the task. Okay? Now, if I'm going to carry this piece of equipment, now you tell me, if I do, hello, if I'm going to carry this piece of equipment, just have a look at what I'm doing. And you tell me what is wrong or how can I improve?
Very wrong. Very wrong.
What is wrong with it? Hello, let's start one at a time, please. Yes. Okay. So number one is neutral flight position. Okay? We talked about principles of efficient moving around. So instead of me doing like this, what are the options do I have? I use my big leg muscles. Okay? So instead of me bending like this, okay? This a lot of strain you are putting on your back. Okay? A lot of strain, especially here. In fact, if you put EMG, you will see a lot of how the muscles are being strained. Okay? And now you can do like this. But think of pulling this weight, now it's pulling a lot of muscles that need to complain. Now instead of me doing like this, the alternative is I can, okay, if you don't have knee or leg problem. Okay? Anyway, that's one way. Okay? I can come and bring the equipment close. Okay? That's one. Instead of doing like this, I can decide to widen my base of support and then, okay? So I still maintain your neutral spine position. Okay? Maintain your neutral spine position. So that's one neutral spine position. What is the other bit that we coming here to talk about? The narrow base of support. Okay? The narrow base of support. So when you can use your base of support to adjust so that you can be able to move an object. Okay? So the base of support, how you move an object. You can adjust the base of support. So you tell me again, what again that we need to improve? Sorry?
The load should be closer to you.
The load should be closer to you. Okay? What? So the load is far away from me. And why is it that why should the load be closer to you? The liver system. Okay? Sorry? I'm not stretching. What is the advantage of me not stretching? I think, yes, sir. Okay?
When you are doing that,
Yeah.
you are putting stress.
Yeah. Okay? It's only on the trunk muscles.
And also the hand and the shoulder.
Okay. Yes. Yeah. Yeah. So the longer the arm, the more difficult it is. Okay? So whenever you go to pull your patient, you're pulling them, try to bring them closer as possible, as safe as possible. Okay? And I will encourage you to try. Okay? Trying to hold objects far away from you and try to hold objects close to you. Try to hold objects far away from you. If you put your hands like this, keep it for a long period of time, you will start to get tired, but bring it closer, it's more comfortable. Okay? Putting the hands far away, a lot of strain apart from the trunk and putting it closer. So we looked at the base of support. Okay? And let's say I'm going to take this object. Okay? I'm bringing it as close as possible to myself. Okay? And I'm going to take it all the way down to the next step. When I come to drop it, hello! When I come to drop it, I guess we talked about the long arm, right? This is not. But when I come to drop it, instead of me dropping it like this, I can just right? And just go. Okay? But again, you tell me again what is wrong and how I can correct it. Anything wrong with me? Twisting. Twisting. What happened with the twisting? What happened with the twisting? Okay, if I'm coming with my trunk, what happens? What's the next? Great. Fine. Okay? So the trunk. when you're twisting. So instead of twisting, the only alternative is for me to from here. Once I have the option close to it, I can stop. So let's stop, man. So just stop. Just use your legs to stop. Okay? So instead of twisting, you can just stop and then you come back to as close as possible. And then I can try to just slide on them on me and then I bring it down and then I'm off. Okay? This is just general awareness of our body mechanics. How you use your body can make a difference. Sometimes it's not about the fact that you use it once, it's the fact that you are doing it over and over again. Okay? Over and over again. Yes? Over and over again. Any question? Any question? No. Yes. Now we can say I will use this and I need a model. Hello? Please, can we have one hand? If you have a question, please you raise your hand. Okay? Now we so that we can listen to each other. Some of the questions are good, please. Yes.
Yeah, I couldn't really follow. Or network issue. Now, to ask them, so if the opportunity is actually affordable now, that where are there biomechanical considerations prepared for us to lay as foundation for this patient handling
Yes, there are biomechanical considerations. So, hello. I would really appreciate this if you should be quiet. I know that we want to interact and chat, but please you are here so that we can. If people are asking questions, they are asking because it's good you benefit from it. Okay? Please let's avoid side conversation. Okay? So what Mr. Babatunde is talking about is biomechanical consideration. Okay? For those that attended on the online session, what are the biomechanical considerations that we consider? If anybody can remember. Yes. The base of support, yes. The line of gravity, yes. The center of gravity. So there are biomechanical considerations that you need to solve. A lot of them anyway, you understand. But we look at base of support. So we talked about the base of support. The base of support is the base at which you are in contact with the floor. Okay? And the wider the base of support, the more stable is that.
I just want to know whether the foundation was laid.
Yes, it was
Going forward into the
Yes, it was me. Yes, it was me. Okay, that's the next one. Yes, it was me. So, thank you. So the next thing is, we have different beds. So we're going to look at moving patients in bed. Okay? We're going to look at one moving patient in bed. A patient that is lying in bed, and then we want to move them. We'll look at moving them manually, using our strength, how we can move them efficiently. Then we look at using the equipment. Okay? I will need a volunteer that will be happy to lie on bed. Are you sure? I think the digital. And once we do this, we're going to practice this and the other ones, and then I will allow you guys to go to split ourselves into groups where we will practice in groups as well. So let's say Mr. Suleiman is a patient who is let's say Mr. Suleiman is a patient that is bedridden, okay? And if I want to first probably let's talk about rolling from side to side, okay? If I want to roll the patient either for personal care, maybe I will want to check the bed source, or we encourage patients to do 2-hour bed turning, or we want to do some personal care, or we want to teach the patient relatives on how to help the patient when they are cleaning them when they are bedridden. The first thing I will need to think of from here, we talk about bending. Okay? So where possible, if your bed height allows, you try to pump as much as possible. Okay, this one is not pumping. But when it's possible, it's what
Right, maybe it's manual.
So if what I will think of, where possible, you raise the bed to your waist level. Okay? Where possible. Now, if it's not possible, we talk about using your legs. Instead of me bending, even if it's low, even if it's low, I can decide to widen my face also. Instead of standing like this and pulling the patient, I can just widen my face also. And from here, I can walk, moving the patient up. And if I'm the only one in the world seeing the patient, what I can do is, if, let's say, this bedridden globally, there is weakness generally, I can think of how we can help you. Okay? How we can help each other. If I'm rolling him to my side, I will take this hand away, because if he's rolling, I don't want him to. This might obstruct my movement. I will ask you, man, can you please take your hands up? Take your hand up all the way. By the side. Okay? If the bed is big, that would be brilliant, but if it's not, and I'll ask him to turn to the side at which he's moving. Can you turn to me, please? Okay. I will ask him to bend his head for me. Can I bring this hand towards me? Now, without even me moving, this has already, you can see it is already coming tilting towards this direction without you moving. So here, if I'm the only one doing, I have to think of where I will put my hands. Of course, you have to ask consent from the patient. Sometimes there are cultural barriers, gender differences, all those things. You need to be sensitive to those environments. So, in terms of hand placement, usually I will put one of my hands around the pelvic girdle. I'm not going to pull him. Okay? I'm not going to pull him. Okay? I'm not going to pull him. No. Because you're straining the patient. Somebody who doesn't have enough muscle strength, you are pulling him. The ligaments, the muscles, they are not too strong to hold him. I'm going to use my hand around the shoulder blade, okay? And then I'm going to use my other hand around the pelvic girdle. Now, it depends if Suleiman can be able to hold this leg, okay? Because there are some patients that are so weak that you can't keep this leg in this position. And of course, some of them you might have 2 people, but let's start with one person. Let's say I'm the only one. If Suleiman cannot be able to, let's say he cannot be doing it, I'm going to do it for him. He doesn't have the strength. I could just have, let's say, 1 or 2 on Oxford muscle going or one or 2 on Oxford muscle going. I'm going to take the hands away. I'm going to ask him to turn his head. I'm going to bring his hand all the way across opposite to this side. And then I'm going to use this leg to bring it up. Now, if Suleiman cannot be able to hold it, I'm going to put my hand just to support the leg, putting my hand across it. Now, it will help hold the leg, and then with my hand like this. Without Suleiman helping me, it's much easier. Without Suleiman, don't help me, but Suleiman did not help me. Suleiman did not help me. Okay? And then from here, if let's say 2 nurses working in the ward, somebody can do whatever they want to do here, and then finish, and then it will roll in and turn to the opposite side. Okay? And then I will ask Suleiman now, can you try to go back? Even if he cannot go back, just by pushing him back. And then Suleiman is back. So how I position my leg, because how you position, I'm going to do it this direction again. So let's say Suleiman will not be able to help me at all. I'm going to bring his head to this direction. I'm going to take his hand all the way across, okay? And then I'm going to ask him to bring your hand opposite. Can you bring your hand opposite, please? Let's say, okay, good. I'm going to use the leg, bring it all the way up, and I'm going to put my hands, and then, okay? Now, a patient that you are turning like this, you have to be mindful that the patient, depending on the bed, they are close to falling. I'm not weak. Okay? Always think so I'm closing the gap. Okay? Yes, I'm closing the gap. He will feel safe, he will feel comfortable. And from here, we can do whatever business we are doing on the side. That is if the patient cannot be able to help. So even without equipment, you can move your patient from side to side without the patient helping. For the nurses, I think this is a brilliant way you can help the patient, but also you can, the relatives, I guess for us, mostly it's the relatives that help, isn't it? So instead of, if they are pulling, pushing, and you see a lot of hands pulling and everything, you encourage them to do it properly. Okay? You encourage them to do it properly. Now, and if it is for us, the physiotherapist is about, if you want to rehabilitation at this active stage, it's about bed rolling. Okay? Bed rolling. From here, you can ask them to roll back, and then gently they are building their strength. You bring them, you roll back, you bring them, and you build that up for them. Okay? So we're going to go back. Now, let's say Suleiman has a little bit of, so that's the first bit. Rolling patient from side to side without any support. You can do it alone, but like I said, you can do it with somebody. Okay? Let's say with somebody. Can I have a volunteer who will do it? Let's say the person doesn't have any muscle strength, but we're going to roll them from side to side. Anybody wants to volunteer? Yes, yes, sir. So you're going to, okay, standing here. So one will stand on opposite. Okay? One will stand on opposite. So if the patient is going to roll forward, so he's going to do the same as I've done earlier. So the patient is going to roll forward, so I will be your second hand. Okay? I will be your second hand. When you are doing with the second person, it's important you communicate. You don't want to entangle the patient in between. Okay? So we're going to roll him to your side. Okay? So first is Suleiman, you're going to hit Suleiman because he can really take his hand all the way away. Good, very good. And his head, just hand on his head, and then we're going to give it his hand. Good. And then we put his leg, and we're going to continue this. So what we're going to do is that I'm going to help with this, and then we're going to help with Suleiman all the way. And we're going to roll on the wall. Okay? Ready? Ready? We're going to work on the wall. Now actually, come your hands here, so that's fine. Okay? You ready? Ready? Steady? Okay? And then the second person will be there supporting you. Okay? And then we can do whatever we want to do and adjust it, and then we'll bring it back. Okay? And then now we'll bring it back. So that's the first bit for the rolling from side to side. Okay? For the rolling from side to side. Now, yes. Okay. Yes, please. You can both of you can try. Go. Hello. Hello. So that's one thing that we're going to be doing if we are rolling patient. If we are rolling patient from side to side. Okay? If we are rolling patient from side to side. Now, if the patient is bedridden, I guess if I ask the nurses, they will say sometimes the patient will, you will see the patient, they are all stuck at the end of the bed, or maybe they are, soon as they are on the one side and you try to struggle, I can see the nurses. How do you usually bring them back to the bed center or adjust them into a positioning? Yes? You use the bed sheet. How easy it is to use the bed sheet? Not? You're struggling. There is friction also. Okay. And you have more energy, more okay. And you need more assistance to pull it. Have you ever sorry? Yeah. Yeah. And have you considered the discomfort it causes the patient? And yeah, sometimes you see from their face how they are struggling. And sometimes there might be some even skin tear or redness and things like that. Now, the aim of this is a slide sheet. The aim of it is to take away that friction, that struggling, that effort. There are different types of slide sheets. This is just for the one for demonstration. The one that was purchased for the hospital, it's the tubular one. Okay? We have the tubular one, which we will be using for practice, but we have also the non-tubular one. So the tubular one is this one I got it. I found here. So this is the tubular one. So the tubular one is a round cylindrical object. That's just the tubular, and you just put it on the patient. Now the other one, which is the non-tubular one, is this one is the non-tubular one. But the aim of slicing is you have to use it one on top of the other. So using only one like this might not be sufficient, okay? Because you want to have those three bits. So if you did both of them,
Can't be full.
you can fold, but this one, that's the tubular one. Okay? It's ready for yes,
Double the layer.
but again, it will have some restriction on how you use it. But yes, you can fold. Okay?
The size of the bed.
Yes. Yes. Yes, you can fold. But preferably, it's two of them. Okay? Two of them, and you lay one. Yes. Preferably two of them, and you lay one on top of the other. One on top of the other. Sorry? No, sorry. Okay? So you hold one on top of the other. We're going to demonstrate with the. So these are two. You go one on top of the other. This is mass. And then you can use the handle, you cannot use the handle. Okay? So we're going to roll this patient. Now this is not a big bed, but usually with big bed, patient might be squeezed on one side or the other. So we're going to try and use it on the back. Okay? Let's assume he has moved to one side. Okay? I will going to try to use this slide sheet on this. Okay? So I think you want to come up to the other side and go and see. So you want to go to the same moving the front chair. Okay, so I'm going to use the tubular one. So the tubular one, you don't need to put one on top, just cylindrical and circular. Okay.
Nobody has seen.
So I'm going to just put it. I'm folding it. So I'm going to fold it and then tuck it underneath the patient. Okay? I'm folding it. And then you will roll back to me. That's come back. And then from this side, I'm going to roll it again on my side. If it's not out, or it's going out, and then you can use it. So without Suleiman helping us, so I would say Suleiman is not going to help us. We're going to move it on our own. Okay? So when we're moving the patient, the same thing, think of this. Where are the devious points? Where are the devious points? Healthy girdle and the pectoral belt. MSC chairman, are we having a forum here? No. Okay. I can hear you. Don't worry. I just say that we can hear you. So think of the pelvic belt and the pectoral belt. So all I'm going to say is you're going to hold one on the pelvic girdle and another hand on the pectoral girdle. And when you are holding, you are not going to hold the two. You're going to hold the topmost part of the sheet. Okay? So hold the topmost part of the layer. And because we want the topmost part of the layer to slide on top of the other. So we hold the topmost part of the layer. Okay? And then if we are going to, we're going to roll in force. Okay? You ready? So we're going to go on the word slide. Ready, steady, slide. Okay? So ready, steady, slide. Okay? And then if you are going to bring it back, you will pose it. Ready, steady. Okay? Yes, so easy. Now you want to come. Hello. So I'm going to do it again on this side. So in terms of the rolling, I'm rolling my hands up. Okay. So I usually like to start with the stagger style and work from forward to back, forward to back. Okay. Instead of standing like this, I myself might fall back. Okay. So rolling forward to back. So one hand on the pelvic pectoral girdle, the other one on the pelvic girdle, and I'm going to go very steady slide. And you have to communicate with your partner because you don't want to be pulling and the other one is not ready. Okay? So we're going to go on the one slide. Okay? Ready, steady, slide. Okay. I'm going to go ready, steady, slide. Go to do it again. Ready, steady, slide. Believe you me, no matter how heavy your patient is, they can roll like paper. Yes? They can roll like paper. Yes. No, so for me, standing position for both of us in terms of
What we discussed concerning
yes.
your basic support, maintaining the spine.
Yes.
Because the way you stood and the way he's standing is different.
So
Yeah,
there's no support here. It's a good point. When you're moving, and I think I will mention it here, when you are doing the shortest for the side of the first line. Why? Yes. So we are lifting it to the shortest. The reason is because the longer one can move their legs as well. The shorter one, I don't think you want them to be too.
That will make you taxi.
Exactly. So it's not ideal. So you do it for the height of the shortest person. Okay? And if you're talking about our foot adjustment, if it's possible I'm taller than him, I have to. So instead of me to do that, so I have to wide to adjust myself. So
That's the difference.
So because I'm tall, the amount of adjustment you will do depends from me because I'm slightly taller. Okay? So that's one. So we can move in side to side. But apart from side to side, we can move Suleiman up and down as well. Now, if we are moving Suleiman up and down, let's say we're going to move him up. You can do two things. You can either move, stand in the direction of the movement, and then you just move Suleiman up, sliding, and then back, sliding, and then back. Or you can face each other and do step movement. Okay? So you can step together at the side. Whichever one you take is up to you. Okay? So you can slide. Okay? So let's do slide. Okay? So I'm going to change the direction of the movement. And I'm going to do on the road slide. Ready? So I just instruction. Go to ready, ready, slide. Okay? So we're going to go ready, ready, slide. Okay? And then we're going to go ready. This is just for demonstration. We're going to slide Suleiman as far down as possible so that you can see how easy it is for him to move. Okay? When you are moving this patient, or when you are using the slide sheet, what are the safety considerations that you have to take into account? What are the safety considerations you have to take into account when you are moving the patient, when you are approaching the patient? What are the safety considerations? Yes, sir.
Avoid twisting self.
Yes.
One.
Yes.
Avoid over sliding the patient.
Okay. Speed.
Yes.
Okay. Anything else on the slide sheet itself? Maybe not for this one. The one that has, the other one that has 2 layers, so they have handles. If you're using them, you have to be mindful whether they are worn. Okay? You have to be mindful whether they are worn so that it doesn't cut. But yes.
Sir, what about on the patient itself? If he has like catheter or something?
Absolutely. So that's the environment. And believe you me, there are situations where people have pulled the patient and then to start moving and then the catheter pull out. It's a nasty experience. So that is why when you're doing your risk assessment, you have to assess the environment. Attachment, any attachment, especially when you are working in ICU. Attachment, any attachment, IV lines and things like that. There are situations where those things have been pulled out because we don't assess the environment. So it is a risk on its own. But what I want to mention, hello, the demonstration I have done here, you see Suleiman slide, he cannot help himself. Whenever you are using slide sheets, you have to take extra precaution. Because it's so slippery, it can lead to your patient falling over. Because it's so slippery, you never leave it on the patient. It's not the best. You never leave it on the patient. Whenever you finish your business, you will move it. Because the patient will slide off, the patient will fall over. With the slightest movement. So that is one of the biggest things that you should never forget. Always remove the slide sheet at the end of usage. Because if not, it's counterproductive, the patient will find themselves. How do you remove the slide sheet? You can remove the slide sheet by doing the reverse of what we've done. Whereby the patient rolls from one side and then roll to the other side. Okay? And then when they roll to the one side, you tuck it in and then you roll to the other side. Let me just show a demonstration of how to do it. So it's going to roll to your side. Let's just hold it. Yes, it's going to roll to your side. So take this hand away. Okay. And then you take this head. And then you roll to the other side, and I just hold this, okay? I tuck it in, and then you roll to my side, you just stay there, and then the other person does just pick it out. That's one way to do it. Then bring it back. Bring it back. However, there might be situations you might prefer. There might be some situations you want to reduce the minimal amount of movement. You know, there are some patients that even the turning and twisting is a work with itself, and you want to reduce that. Okay, so you don't have to turn it up, lean up and down. You can decide to now try to tuck in this end on it. So you can decide to tuck the end of the down part of the other slide sheet underneath the bed, and then you pull, you bring it out. Especially when you bring the one on the one that have two different slide sheets, it's easier. But you can do it with the tubular one as well. So, yeah, that's fine. So you just try to hold the down part, and then you try to hold it. Without it moving, I will remove it. Okay? Without it moving, I will remove it. So that's one way to do it. Another way is if your patient is there is also if your patient is bedbound and you cannot turn him to put the slide sheet, you can also put the slide sheet with the patient just like that. All you need to do is you're going to fold your slide sheet. So you're going to fold your slide sheet. turn it, flip it on one side or the other. And then if you put it underneath the patient, so we want to, if the patient had pillows, we just put it underneath the pillows. Okay, and then we just yes. So we will take all the underneath. So what you need to do is we're going to put in the downside. Yeah? So you hold this one, hold this one. So there are different layers. So you put this, and then you pull. So you pull from here. So you pull to slide close. Yes, put your hands like this one. And then you hold this one and pull. And then you hold this one. So without lifting the patient up, you can still hold the slide shot underneath them, make it comfortable for the patient. Okay? So that's another way. And the same way you put it, you can still remove it without you holding, or you can just by pulling it. Okay? By pulling it. The same way you want to try it. Just grab the one underneath. That's one. You want to try it. You want to try it. Just pull it. Don't worry about this one. So when you are feeling, that's it. And then you remove the splash. Okay. The question Suleiman is asking is, when you are removing it, which one is it, the top layer or the down layer? You are pulling the down layer.
The downmost layer.
The downmost layer.
Yeah, that's the one.
Okay. Yes. So when you are putting it, doesn't matter where it's from. Any questions? So that's one if the patient is bedbound. Okay? One, yes. Good question. What if the patient is having breast sore? So we try to avoid that. But if the patient is not having breast sore, I guess there will be dressings. We just need to be extra precaution. With patient breast sore, I will probably say from side to side. I will just put it, and then we can move him up and down even with the breast sore. What we are moving is we are not moving the patient on the sheet. We are moving the sheet on top of the other. So the patient is static, is on the topmost sheet, and the patient is moving up and down on the downmost sheet. So it will not necessarily create that disturb the dressing of the breast sore or things like that. What will possibly disturb the breast sore is when you're doing the putting of the slide sheet, you want that the patient is not moving when you are trying to drive it around. But we can avoid that by just holding them from side to side. Yes? Yes.
Assume I'm the only clinician.
Yes.
Yes, how can I do the law? Me and patient.
So standard practice requires two people to use the slide sheet. But again, you can standard practice you can do. However, sometimes you can modify and use the slide sheet where the patient has ability, but because of friction they cannot move. Because there are patients that when you put the slide sheet for them, it will be easier for them to just swing. So if they are trying to move themselves, they can, because they will get stuck on the bed. But once you have the slide sheet, they can just easily move it. Yes, so you can use it, but it depends on skill set, what you want to achieve for the slide sheet. I also use slide sheet sometimes, when patient is sitting at the edge of the bed and you want to move them up or down. Sometimes it's difficult, especially patients that cannot stand up. You can just use the slide sheet and then you can roll them from side to side. Not necessarily to the pure function, but I can use it from moving patients from side to side. Or maybe let's show some demonstrations. Yes, sit at the edge of the bed. There are patients that if they are seated like this, okay, and maybe you want to do something, maybe they are sitting too much close to the bed rest, and you want to bring them all the way down a bit, to sit at the midline, or maybe you want to do some manipulation, or maybe you want to use the hoist, there is no space, and you ask them to shuffle, they cannot shuffle. You can still modify the use of this slide sheet so that it can help to bring them all the way to this side. And how you do that is, you can put them in the slide sheet. So all I ask the patient to do sometimes is up, down. Yes, so one is that you want to either move them side to side or they are way into the chair. I will talk about that to start, because when they are way into the bed, for those that attended the theory, it's difficult for them to stand up because their body center of mass is already displayed. And you want to bring the center of mass forward so that when they are going to stand, it's easier for you. So, and the patient cannot come forward, and you try different methods, okay? Because there are manual methods. Manual method is where you ask the patient to shuffle, okay? Or you can assist the patient by asking them to shuffle, whereby you can just try to use one hand around the pelvic girdle, and then you shuffle forward, and then you shuffle the other side. But if they can't do it for the slide sheet, we can ask the man, all we can do is, so we're going to use this, I think we stay on the other side. So not just stay. So Suleiman, what I want you to do for this, I want you to try to do most of this. So once the patient leans on this back, we can put the slide sheet. As much as possible. If you cannot leave the leg, we have them, but if you can't, we have them to leave the leg. And then you want to control you. Now, remember the risks we talked about. Slide sheets here is very good. This I will highly say never and I can bring you here, okay? And if I want to bring him a bit forward, I will make sure that I'm here, okay? I'm supporting him so that he doesn't go really come forward, ready to slide, okay? Bring him forward, okay? Just to make sure that he has center of mass place forward, and we can easily do sit to stand, okay? And then let's bring him back. Thank you. Do you want to stand up? Any question on this? Okay. Removing, you go to the reverse of it. The reverse of it is there, and then I will talk again, and then you move to the other side, and then I talk again, and then you do it. Okay? So you do the reverse of it. You want to write that? Any question? Yes, sir. Yes. The situation where the patient will come from control. That's a good question. In a situation where the patient doesn't have a self-control, okay? The first question is, are you sitting the patient? If you are doing sitting, you will do seated exercise for the patient, try to do sitting. But if the patient doesn't have self-control and you want to sit the patient, and the patient cannot move and you want to do this manipulation, what I can do is, I'm not going to put the slide, but let's say he has the slide here. If me sitting here, I can ask a third person who will be all pillows. Somebody here with pillows who will support the person. Okay? And here the person can now support the person going forward. I agree with you because the patient sometimes I have to put one of my hands here. If I don't have a third person, only two of us, one here and then one on the slide sheet, and then I slide the sheet. Okay? Forward and back. For the person, I will ask the patient to put their hands or to either use their hands to support an object, but mostly I find it useful if the patient put their hand across their chest when you are using slide sheet, so that they don't grab object and when they are moving and then you are pulling an object. So just ask them to put their hands across their chest and then you go up and down to side by side. So the easiest way is having somebody supporting the person from behind. But in the other options, one hand, you can leave one hand on slide sheet, one hand supporting the front. Okay? You want to lie down? Yes. Yes. To go inside. So you mean when he's sitting at the edge of the bed, lying? Okay. Can the bed move? Yes, so sometimes you encourage advice.
Unlock the bed.
You unlock the bed, you push the bed, and you have to come to the other side. So you have to unlock the bed, push it, do your manipulation, and then push the bed. So that would be the easiest thing. If it cannot be moved, then you have to, then because the one thing you can think of is the bed, already the patient is in the bed, and it's on the wall, and not on that end. So maybe you can think of on this side, once you hold the person, the only risk is that you may have to, because what you want to avoid is going all over. Okay? So when you're going, in terms of the slash, when the patient rolls on this side, you can put it on this side. But on this side, you have to hold on this side, and you have to go all over and then unroll it. But the movement will only be in this direction, and then in this direction, one way. You can use it one way, okay? And then up or down, and somebody can support it. But on the basis that there is no space for the patient to fall off on this edge. But you can use it in one way system on this, but it will be restricted, or you can see it, and we can practice it here. Okay? Another way which is apart from the slash is, yeah, I think that's not the only one, that one when you use the slash. But ideal situation, move the bed, have the person one. You know sometimes this happens, and you can use that without one person, only or two people, one here, and then one the other on the other. Apart from slide sheet, the next thing is we talked about you manually rolling the patient using slide sheet. We can use bed rails. Now I find bed rails. I don't think that you are able to install this. Elaborate bed rails in them. I say I can go. Yeah. Okay. We have one just for demonstration. Now, this needs to be said. There are different types of bed rails. Some of them have knots. With the ones with knots, it's easy. You can adjust them at the edge of the bed. But this one doesn't have knots, so it's screwed. So once you screw it, it's fixed. Usually, you can put it at the edge of the bed for patients who have upper strength, and it really helps them to function on their own without waiting for somebody to pull them out. Now, if we say this is our bedroom on this edge, and then there is another bedroom on the other edge, if Suleiman is going to stand up, all he needs to do is This hand, opposite hand, will reach across the bed rails. Try to reach. Good. And then if we teach Suleiman, we have we don't have so the problem is not the whole idea is if Suleiman hold it at the edge of and then from this direction, you can use the bed rail to scoop it up. See that direction. And if they have bed rails on both sides, as a rehabilitation, I always encourage the patient to like bed exercises, hold exercises. When we are leaving the patient, we ask them just roll it, hold it, and then he turns halfway, and he holds himself maybe count of 10 or 5, and then turn, hold himself to the count of 5. So I usually encourage patients to be turning side by side. It's very important for their bed movement. We have them move from side to side so to enable them to turn. So even in the wards, if there are no bed leavers rather, they may have bed rails. You can think of using the bed rails whenever you go in for the nurses. If they can use their hands, just ask them, hold the bed rails and then pull to one side. The only trick is bend the leg opposite and then they push here and they are pulling here. If they cannot push here, you can support them here. And then they pull to one side. And then they do whatever they do and they move the opposite side. For physios, you can do them as bed exercises. For them to be holding themselves as much as they can. Some of our patients, for them to roll even it's a hard work. And if you ask them to hold in that direction, they can't, they fall down. So that's the training you can give them. Just rolling gradually. That will build in their strong muscles and the sitting balance that we are talking about. And it's one of the things that they can do to help with the sitting balance. Thank you. We're going to take this. Now let's take, for example, if a patient, we're going to move the patient manually. Okay? Manually, we're going to sit him up manually. Okay? We don't have bed rails, but the patient has some ability. Okay? Some ability. So we are moving away from bed activity. Okay? Bed rolling side to side, up and down. We are going to transfer now to bed to sit. Okay? Bed to sit. Bed to sit. And let's say a patient can be able to have some ability. Okay? Has some ability. Or maybe let's say they don't have ability and we have to move them to sit. Now we don't have equipment. What can we do? We do the same rolling to one side. We bend the legs. Okay? Take this one arm out. Do this as opposite. Okay? And then we do the same rolling from one side. Let's say they don't have ability. I guess in most of our practice, let's say we don't have equipment. And you have to do it manually. And from this side, I will want you to come together. Okay, let's say I'm going to do it one person, and then we're going to do it two people. From this direction, if they don't have the ability, but they have some ability to be able to sit, I'm going to either ask them to push here and help me when I'm sitting up. And then I'm going to bring this leg out all the way. I'm going to put one of my hands underneath Suleiman's shoulder. And I'm putting my hand on the pelvic bone. And from here, I can bring Suleiman into the That is if you are only person. Okay? I'm going to bring So I'm taking this hand, okay? I'm bringing this towards me, I'm bringing this head, I'm bending this head, okay? And I'm rolling towards me, I'm taking this leg out. I'm putting my hand underneath the shoulder, just on the head. So I'm stabilizing this pelvic rib, okay? And then I'm going to let it steady sit. So easy. Okay? Now he did not have it. if you are the only person. Now, but if you are not the only person, you want to go back. If I'm going to come and I'm going to do the up, I'm going to do that. I okay. So I'm going to do the we're going to do the same, but this time around two people. One person will be helping with the lower limbs, another person will be helping with the upper limbs. Okay? So we're going to do the same bit. Then the next for okay? We roll it to one side. Okay? So for the person holding the lower limb, what you're doing is one hand will be around the knees and the other hand will be around the ankle. What I'm doing is I'm suspending the leg. Okay? I'm suspending the leg. So we're going to go on the seat. It's going to be ready, steady seat. You have to move at the same time, okay? Because we don't want to crush it. Okay? So ready, steady seat. Okay? I'm dropping the leg. I'm just dropping the leg. I'm dropping the leg. Okay? And yes, I'm bending and dropping. Okay? I'm bending and you want to go back. So what I did is I bend and drop. Okay? I'm bending and dropping. So we're going to bend one more. Okay? From this position. Yes. Okay? Ready. Steady. Sit. Okay? I'm bending the leg. Okay? I'm bending and dropping. Now, the third one, before we take that question, if the person has a problem with sitting down, okay, we need three people possible. Okay? The third person will be here. Whenever the person is sitting, we will support the person in this position. Okay? And then we'll ask him to look up, make sure that he's sitting balance and everything. And so you can have a third person who will be supporting you, or maybe two people. Instead of me supporting the leg, I will be here. He will be in the front and I will be here supporting the back. Okay? Yes.
It seems to get to a good state.
Yes. Sorry?
It seems to get to a good state because
Yes. So it's just the normal body dynamic. So it's not a wood that you want to keep it nice and straight. You want to lie up. So if I'm bringing the leg, okay, if I bend it like this, because it's the normal body dynamic, just sorry. So I bring it like this. I'm going to the right. I'm following the normal pattern of movement that you do when you're doing yourself. Okay? Because when you're doing yourself, you might just when you're sitting down, you just and then bring your leg. Following that normal pattern of movement. Normal, because it's not if you're making it nice and straight. Probably abnormal, unless it's there. So the normal pattern of movement. So I'm bringing it up and down. I'm bringing it up and down. Yes, I move it up, I flex it, and then I let it go down. I just do it. So I follow the leg softly without restricting the movement. Any question? Yes.
Thank you very much.
Yeah.
Is it okay to stop the patient
want to do something and then we cannot. So if you can make it, if it is possible, you bring the bed rest up for those beds that are allowed, and then from there the patient can. If it is not, we ask the patient to bring the leg all the way out, bring the all the way out, and then try to push, use this hand, push, push, and then I just encourage them and put your hand like this. See? And from this position, you can now. I'm going to pause here. Is there any question? Okay. There are beds. There is one, two, 8 beds, and there are slide sheets, almost 50 of them. So what I will say is that whatever you've done, okay, try to start. I want everyone to demonstrate with groups. We expect about 8 of us, 8 per group. Maximum of 8, 5 to 8 per group. To pick a slide sheet. And now I'm going to break in 1 hour's time. So I know we probably might not be able to finish all the practice, but we're going to start now. And then when we come back from lunch, we continue. What we will do is, in your groups, one person will have to volunteer like the person. You start by bed rolling. So rolling from one side to the other. Just bed rolling from one side to the other. With one person or with 2 people rolling. Once you finish rolling, then you move to using slide sheets. By putting the slide sheet in and removing the slide sheet, sliding the person up and sliding the person down. So these are the 2 things I think we might. If we have time, we can also consider sitting at the edge of the bed. So these are the 3 things we've done. Rolling in bed, without slide sheet, then sliding slide sheet, then be able to transfer the patient to sitting at the edge of the bed. When you are free, think of your body matrix, think of your foot placement, and those that are around can give you feedback on how your foot placement and how you do. For those of us that are wearing covered glass, you will be missing out if you get it for us. I'm not sure how to do for you. But if you can, by all means, you can be a monitor as well as you can be a therapist. Then, if there is no question, please, if we are crowded in a place, I may come up and say, ask you to move to the other place. But I expect everyone to be able to find a place and practice. Find a place and practice. Let's do that.
Allah.
Ana daukan ku ba. Jamila, ya ce dauka ko ina ne. Ko gama satin bane.
Iya aka ce mun wai za ka kwana a gwajo ga na ce kar ka fara. Yaushe da kuna hanyar
A kashe? Yes, yes, sir.
All right, I think we can start now.
Already, I read.
Before we went on break, before we went on break, when we are doing the practice, some people have asked questions. And there are two questions. I think one was asked by Musa, who asked the question earlier. And I think one question is from the nurses. And they are not valid. So we'll start with your question, and then if I still remember the question, we'll go through the question. Makes sense? You want to share the question again for us? Okay. I think the question he mentioned about is, what is the ones that when you're using this slide, is there any policy around it in terms of you use it for the whole body of the patient? So, for example, you use it for patient A, use it for patient B, or is there a particular number of, like, let's say, one selection per line? Now, as in the recommendation is to use one selection per patient. And yes, I know one selection per patient. That is the recommendation. And the reason is because the main reason is to reduce the infection, yes, cross infection. One selection per patient, where possible. You keep them in either in the hospital or in the rehab centers. You find them in the lockers or where you keep their clothing. You find those selection there. However, if it is down here, what I would say is that we can consider using one selection per patient, because we may not have all patients that need the selection. And what we can do is, whenever the patient doesn't need the selection, we have the laundry unit, okay? Which I think that's what we can do. The laundry unit who disinfects clothing materials, we can hand them over and then they clean it and they wash it and they recycle it. So we can still go ahead and do one selection per patient. We just need to collaborate with the laundry unit who will help us in the disinfecting. And I think here is a collaboration, the laundry unit that they have. And what you guys should be doing tomorrow in the clinic, you will take the slide and use it for each patient requiring a clinic. However, at the end of the day, if you finish and you have to go to use for a different patient, we need to work every day to use here. So we need to collect all those ones that have been used. If it's not going to be used for the same person, for us to take it to the laundry unit and wash and sanitize, and then we can then take it back to them and use it for the okay? So the selection is one patient selection. Depending on the number of patients you have in the world. But sometimes also it depends on the type of patient, because you use slices for patients that are heavily dependent. If you have able patients, some would categorize patients from their level of ability, or maybe from IQ stage, etc. So you may not use slices. So you just calculate the number of beds in that ward with the expectation that all beds will be occupied by the patient, and then you can make provisions for those slices for the patient. That would be what I would say to you. And the plan is hopefully by the end of this program, we'll write some communique or conversation with collaboration with MRT to put that to the hospital management here. That's the proposal. The second question that was asked by the nurses is, she mentioned that there are in their unit, they usually carry patients up and then put them to another table. And she asked if we can sort of other way of using slide. Now, using slide sheet for any use of equipment, we have to consider how fit the patients are. For example, what she mentioned when I asked is the patient that have gone to surgery. You know, sometimes when people undergoing surgery, there are some cautions or safety considerations that you need to consider. For example, mobilizing patients, the surgeons may ask you not to mobilize them after 24 hours, or certain movements that are restrictions on certain movements. For patients that usually go either going into the surgery or going after the surgery, some patients there is that very limited restriction of movement and things like that. What I recommend, I don't have the piece of equipment here, is usually they use axle. Now I asked them whether they come across it and they said probably they don't have it one. Let me ask the wider question. Do we all know what I mean by PATSLI? PATSLI. Anybody have come across PATSLI? Okay. So if you are taking a patient that you don't want to disturb them, usually in theaters or when patients go into surgery and you don't want to move them, you use a PATSLI to transfer patients either from their bed to the theater table when you're taking them, or when you come up to the theater table, you transfer them from the PATSLI to their own bed, recovery bed. For the usage of PATSLI, it requires about 4 people at least for you to use PATSLI because the person is quite very, you are not moving them up and down, and you can have high people. With PATSLI, so PATSLI is basically it's different from banana board. This is just a banana board. The PATSLI is a big sheet of material like this, like a slide, whatever it is. But it can be as big as the bed. Okay? It's as big as this bed. All you need to do is you have one bed here and you have the other bed. It starts as a bridge between the bed of the patient and the theater bed. And you put it in between as a bridge, the PATSLI. Just the slippery object there. And you use the slide sheet, usually preferably from the point, if the patient, you transfer the patient from the point that is slightly higher to the point where you are transferring them. So you are transferring them from a higher point to the lower point, usually. So once you put the PATSLI across, it bridges that gap, because when you bring the bed to bed, there will be a gap. So you put the PATSLI in between, and it bridges the gap, and then you use the slide sheet, and you just slide them from that PATSLI to the other bed. Now, in the use of the PATSLI, you will have 4 people. One person will stand on the lower part, pulling the sliding sheet. The other person will stand on the upper part, pulling on this end. Because imagine a patient is on the bed, so usually they put their legs across, and then they reach out. Okay? Not try to do not like this. Okay? They usually put their leg across, and they reach out. In the other slide sheets that I brought in, some of these things, the advantage of this is they have ropes. You can use extenders. Instead of you bending or putting your legs, you can just have the extenders and then pull from that extender. So once you put the PATSLI, the one person will want to stay, and then the other person will stay on the opposite side. From that, the other side is the same way we demonstrate the use of the sliding sheets. The other person from the opposite side will be pushing, while from there they will be pulling. And then the fifth person, so you have 1, 2, 3, 4. The fifth person will be stabilizing the head, especially for patients who either spinal cord injury that you don't want them to move, or somebody that has just undergone surgery and there is limited movement. So you have 5 people that will support the patient, transferring them from this bed to the next bed, or from the next bed to the next bed for the PATSLI. And that's how you sort of transfer patient using the PATSLI. But I know equipment might not be always available. In that case, just we need to figure out exactly what is the medical precautions of movement. If we can move the patients, then I will probably encourage us to use the slide sheets or to ask the patient to transfer to either use the banana board if they can sit up, or we use the other pieces of equipment that is available. If we are using a manual method, then we just need to use the basic biomechanical principles of transferring the patient from one point to another. Carrying the patient is certainly not the best option. Carrying the patient is certainly not the best option. So that's the response to the second question. I think the nurses asked. Most of them are not good, but PATSLI we have been the pronunciation. Yes. Okay, they are back. Okay, you are the one that asked me. Oh, they changed their uniform. Oh, they are back. Okay. Yes. 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 So So you don't have to put the slide sheets in that data another way. But for the person that will use it color, some of them you can still turn their own like a fixed object. If they can turn one side to one side, you can use the only one side. Or you can decide to put the slide coming from under instead of coming from above. So when you put it from under, it can be easier for them to use it. So that will go from under instead of above. Yeah, and you can roll fine as a rigid log try to yeah, yes. So you don't
were expected to set down this there any preparation how we can this?
That's a very good conversation. I think we can have this conversation outside. The nature is here. We can vent it for you as together as but it's a conversation with the supply is here. Okay. So yeah, so it's something we can have a conversation. But with regard to you, I think you for those that are representative and we will need to catch up tomorrow when you guys are going on the road. It's something that we need to go. I think I will mainly be with you tomorrow when we are going out for the seeing if there is no question, let's move to the next bit. Yes, sir.
Using the pass slide.
Yes.
What would be the position of the pass slide? Okay. When you are trying to, like, for example, when you do patients from the bed, probably one bed to the other.
Yes.
Or one bed to that other table.
Yes.
Controlling.
Yes.
So what will be the position?
Now we have two beds. Let's use a quick demonstration. Right? Yes. I think some people are talking about log flow. You want to share with the product class? Log flow. I think you mentioned about log flow. Okay. Oh, you are talking about log flow. No, it's asking questions. Okay, go. Yes, log flow. Because a person moving to person, which is a different word points. Just yes, so it's like that. I'm not that's true. Let's put the bed head of the bed on this side. This one, the head Let's manage it.
Practice.
So, just as a demonstration, we don't have the pass line. Okay? We don't have the pass line. Now let's assume, okay? Let's assume this is our pass line. Okay? This is our pass line. All you need to do is, usually it's a rigid sort of a big board, a big hard board. All you need to do is you put it in between this rigid frame, and then it will cover the bridge. Okay? But before you put it, can I have 4 volunteers, please? 4 volunteers. One person will stand there, and then the other person will stand there. So if let's say the person is not going to hold a lot. So we go to, if let's say this is our pass line. So we are going to put our pass line. We always do, we go to do the same rolling procedure that we done in the morning. And then we're going to hold it. And then, yes, so this they will bring the pass line just in the between the bridge. And once they put the pass line, the fifth person will be supporting the head. So one and just okay. And then let's go. Let's handle cannot be roll. Let's roll. So once we roll it in this side, now we're going to put our sliding on top of the pass line. So try to go our sliding. But this, the person here, the person who is supporting one hand is across there, not on top of here, just supporting you. Let's assume he cannot move himself, and then wait inside, and then we can. Let's do it again. Let's say he cannot move himself. Let's assume he cannot. So drop it in and continue. Good. Let's go back. Okay, good. So let's say he's going to slide to your side. Okay? If he's going to slide, you and I will be pushing in this direction. Okay? One person needs to come here and you'll be pulling the top part. Okay? Just the same slide, you just rock back. So you are falling back, you are just pushing. Okay? So we go to go and then yes, and then this two will be supporting the other. We're going to go on the word slide. Okay, I'm going to say ready, steady, slide. And we're going to move on the word slide. Okay? And we're going to take it all the way like we're going to land on the bed. Okay? Ready, steady, slide. Okay? And that's it. And then they are going on the next one. And that's it. And then we turn him, the same bit, and then we remove the sliding as far as okay? So we can turn it on the other side. And then that's it. So for if you are transferring patient from one bed to the other. Yes, that's for no lifting at all. Yes. So earlier on we've already considered sitting patient at the edge of the bed. Okay? So Suleiman, I will assume that you're already sitting at the edge of the bed. So, in terms of whenever the patient is seated at the edge of the bed, should we leave him hanging like this or should we lower the bed? And what do we want to achieve when we are lowering the bed? Feet on the floor increases the base of support. Okay? We want his leg to be in contact with the floor. And if his feet is on the floor, what do we say? Should we allow him sitting way back into the chair or should we allow him ask him to come forward? Why is that?
Break the center of the
forward, okay? So that when he's standing up, it will be easier for him because once he displaces the center of mass. So Suleiman, can you please come forward for us? So if the patient cannot move, I showed earlier on in the morning how to use the slide sheet. But sometimes if you don't have slide sheet, I tend to, you can use different positioning. So all I need to do is, if I'm not using the slide sheet, just to lift the weights they put in here and then slide, and then lift here and then slide, and then lift here and then slide. We also can do it ourselves. So, but you have to teach them. That's where this communication comes in. If the patient cannot follow instructions, no matter what, you just glue it to the chair. Okay? Slide, slide. So I'm going to ask Suleiman to try the sliding one, and then we do the one that, let's say, he's not able to slide, I'm going to help him. Okay? So what I want you to do is, you're going to put your weight to the other side, and then slide this leg, then come put your legs to the other side, and then slide this leg. So let's do slide here. Good. That's it. Now let's slide over to the side. Good. And then by the time that smoke is already back, and sometimes you can assist the patient if you want to go back to the side. And sometimes you can assist the patient by trying to slide forward. Good. And sometimes it's not the amount of force you put in front, just the manual guidance. Those are tactile stimulation just to enable them to move forward. Okay? Slide, and sometimes for those that are heavily dependent, sometimes I just give them a little notch on them just to try to take off the friction when they are sliding, and then give them that manual guidance from the hand for them to slide forward. If our patient are in this position, if they can, what type of patient muscle strength wise are you looking forward to sort of standing? Lower limb wise. Okay, 3 plus and above, okay? Yes. So for patient 3 plus and above, you're thinking of, or 3 and above, you're thinking of they can sort of move against gravity and maybe they can maintain their legs, or you can also support them. But there are patients even without a 3 plus, some of them, maybe you can be able to support them either stand or to move from the bed to the chair. And there are different pieces of equipment. Now, if we are going transparent remark from the bed into the chair, one of those equipment we can do is go with the wheelchair. Do you have a wheelchair? We have it. Okay, I want to have a wheelchair. No wheelchair. Okay, that's fine. We don't have a wheelchair.
One of those.
Yeah. So if a patient, sometimes if you want to so standing the patient, what we say when we want to stand the patient, we talked about sit to stand generally before we use the piece of equipment. Talking about sit to stand generally, let's say I'm going to support my patient. What are the things I need to, what are the preparations I need to do for this patient to be able to stand up efficiently? Starting from the legs, what do I need to make sure he has done?
Widen the base.
Widen. Okay, not too much, just shoulder with the back.
Yes.
What again?
Flex the knee, semi-flex the knee.
Semi-flex the legs on the knee.
Yeah.
So slightly bringing the legs back.
And then lean forward.
Lean forward and facing that way. Yeah. And when you're telling, sometimes you just tell them nose over toes. Yeah. Because sometimes when you are telling those technical terms to a patient, they won't know what you need to say. So just bring their nose over toes, and then all the things you are explaining, they will be able to do it for you. Once they bring their nose over toes, they've done the things that they need. And then what all happens is like an aeroplane is taking off, okay? And then they go up all the way up. If so if one person, you are supporting the patient, if the patient can stand up, brilliant, let them do it themselves. Okay? If the patient can stand up, brilliant, and let them do it themselves. But if they cannot stand up, this is why you support them manually. And if you are supporting them manually, one person, let's say both legs are of equal strength. Okay? You can support them with one hand all the way across, and then this hand is just for protection, just in case they overreach or they fall forward. And I'm going to stand with the patient. For me, it's easier. And I'm going to give him the instruction, either 1, 2, 3, stand on the whole stand. You already steady stand on the whole stand. Okay? So Suleiman, we're going to stand up. Okay? You're going to stand up on the whole stand. Okay? I'm going to say ready, steady, and then start. Okay? All I want you to do is imagine that your plane is taking off. Okay? So you bring your nose over your toes for me, please. Good. And then all you need to do is You stand up on the road stand. Okay? Ready, steady, stand. The one is serious. He's acting like one as a patient. I did my hand. He would have fallen off. Seriously. He just so ready, steady, stand. Okay? And then from here, I can just support him, make sure he's steady. Okay? And when you want to sit down, sometimes, from here you can do whatever you want to do, which is not the point of this session. Okay? And then from here, if you want to sit down again, so finally what we tend to do is we ask them to feel the back of their chair. Okay? They feel their chair with the back of their legs to make sure that the seat is there. Okay? And then from there, if they can, we ask them to reach. Use one of their hands to reach. Use one of your hands to reach for the chair, armrest, and then you sit down. Okay? Can we sit on the opposite side so that?
So we are all standing. Where is the focus? Is it down or forward?
Where standing?
No, yeah, right from the yeah.
So I think so. Let's say aeroplane is taking off. Okay?
So you're standing.
So first of all, is it me or you? Right. I think okay. Is it the instruction you give the patient?
Yeah, I mean,
The question is where the patient okay, the word is straight.
yeah, straight. Forward,
What will you
forward, where is stepping over?
So, of course, we give instruction. Patient will vary differently. It depends. Naturally, I would say the patient will start from forward and look up. Okay? It's a transition movement, so it's not going to be a fixed point. So you look up and then, so you might stand forward and look up. Okay? But there are patients who might start, because when you see those who are close, they will be looking down, and then once they reach here, they will look up. But there are patients that they will not necessarily follow the instruction of that transition. If you see a patient is highly fixated on the down bit, then it might be a question of the one to encourage them to just head up right from the beginning. So even if you see a patient that they are usually afraid of falling, they are like this, when you fall down, I will encourage them to go down because that will counteract their ability to stand up. So I will encourage them to go down because those patients are more likely to just bring their head up. But it's naturally a transition movement from their head down and then all the way up. When you are moving from head down and all the way up. Absolutely. But if your bed, you can use your bed height to manipulate seat to stand. The higher the bed, the easier it is for the patient to stand up. But if you are able to raise the bed height or change it, some chairs like this, if the patient is sitting, you can't change the chairs like this. Some beds you can't lift the bed, so you have to rely on what you have. But if you can lift the bed, lift it up higher. It's easier for the patient. But in our rehabilitation, we challenge the patient by lowering the bed so that it tax the patient to stand up. But apart from the bed height, the way the patient is seated, like you say, if you are sitting way back, it's difficult compared to when you're sitting forward. Any question? Just roll on the other side. So where I put my hand is, I put my hand across here. Now, if you are doing two people, one person can put their hands here, and then the other person will put their hand here. In other texts, you find there are also handling there in other places. Other places find handling there quite restrictive, but some people have handling there. So it's a belt that you wrap around the patient, and then one person will hold at the opposite on the other side, and then the other person. But without the handling there, it's this bit, and then from here I'm controlling the patient. One other hand here to just, if I know the patient doesn't have the control, okay, just to avoid that excessive forward translation and that likelihood for them to fall forward. And then just to demonstrate, you want to bend the legs slightly for me, bring your head forward. Okay? So we're going to start on the whole stand. Okay? Ready, steady, stand. Okay? So I'm not necessarily pushing, but I'm here. And if it needs to be, I can give you that slight movement. Okay? I can give you that slight nudge. It's just to give that nudge. You are not fooling the patient. If the patient requires a lot of effort, then you might need two people you might need somebody behind you to facilitate that transfer. But just to give you that manual guidance, those tactile simulation that will stimulate the patient to stand up. Thank you. And you want to come on where we are?
So, and I like that some patients are very
Yes. So if you want to sit on it. So apart from one person, somebody can come and then the other person the same will sit there and sit there and then we'll do the same movement with two people. If the patient is heavily dependent, okay, somebody will do the same movement with two people. If both legs are not strong, one leg is weaker than the other, like the stroke patient. Apparently, one person will stabilize the leg, and then the other person will stand here, and then you will stand. Okay? Or one person, if it is one person, if you block the leg, or somebody will practically bring a chair, stabilize this leg, and then move. But if it's a stroke patient and you are afraid of buckling on this leg, somebody will have to practically support it. But let's assume you are not moving the patient yourself. The patient has a bit of compilation. This piece of equipment can take away the ability for us to pull the patient. If we cannot train the patient with a little bit of manual guidance, then we can use the patient one. Now, this is not for transporting patient, but this is simply for helping the patient to do sit to stand. We're going to try it, Suleiman. And you can adjust the knee. Okay, well, this guy is really loose. I think I have. So I think I misplaced one. I think I have one of these. I will go and look for it. Yeah, I think. So you can, that's fine. So you can adjust this to the knee patch, knee shield around the knee of the patient. And all you need to do is bring it in. So so let's say I'm transporting my patient. I don't want to carry this patient from where he's sitting here manually. Because one, you cannot stand, I'm afraid of it buckling, and I want to transfer him from sitting at the edge of the bed to sitting here. I use this. There are different variations of this patient corner. There are the ones that